we really want to not just be a place where you can order your products and say, here you go, because there's many different places out there. We really want to provide that back end support so that you as the chiropractor are armed with that knowledge that you know how to not just use the product to the best of its ability, but also obviously support your patients in that respect.
All right, and as promised, I'm here with Dr. Anthony from Doc Shop Pro. We're going to talk down DME, trends in the chiropractic space, everything you need to know about ordering products in your practice. Anthony, I appreciate you coming on today, and it's great to connect with you.
Yep, absolutely. Thank you for having me on.
You got it. So let's start with DME, because I know that that's a big component of what I've seen you write about. And you've done a great job. I think so many docs out there, they have so many questions around it. I know I've been confused in the past. I'm going to start with the most basic question of all. For the docs out there that maybe haven't explored that world at all, what is DME and why do docs need to pay attention to this in and around their practice?
So DME is what it stands for, is durable medical equipment, right? So most commonly it gets lumped into this term of it's DME. It's related to, braces and walkers and canes and, really more at-home products. But DME is really an all-encompassing term that includes literally everything from your daily consumables. It could be TENS units and ultrasound units to lasers to different types of tables, all the way up to again, other capital equipment, maybe like an x-ray machine. So it's very all-encompassing. And for what it means for a chiropractor is this is everything that you're really using on the day, on your daily basis in your practice. So things that you're prescribing to your patients are often under the category of DME or durable medical equipment, and many things that you use in your office on a day-to-day basis, they all fall underneath that DME umbrella. So
I gotcha. That makes sense. And if I'm a doc now thinking about, I'm saying, okay, I get it. How do you start to consider what's good products to have in your practice? What should I have? I know it depends probably a lot on how the doc approaches his or her practice, but on somebody who checks out Doc Shop Pro, they're looking, they're saying, I'm interested in learning more. I'm interested in getting into this. How would you recommend somebody who's new to it starts to think about what they should have in their practice?
It's a great question. So first and foremost, we want to know what type of practice that chiropractor has or wants to have, right? If they want to focus on maybe a cash-based wellness practice, or maybe they want to have more of a personal injury type of practice, or maybe it's even like a heavily populated Medicare practice, those are all going to differ in the types of DME you may offer and want to prescribe your patients. So that's the first thing we would want to know. And then once we have that baseline knowledge, that's when we can look at and outfit really what a chiropractor would be best in using, and then what's going to be best to market to that population. So again, if it's a commercial insurance-based practice, we want them to also not have the correct products in that practice, and that's something that is these products that are commonly reimbursed and are so the chiropractor's not having to go time and time over again resubmitting code after code, something that's a little bit easier to use and use in their practice. So we also want to provide them with the proper codes for those different DME products so that it's more of a streamlined and very easy route that they can follow so that they can start implementing more codes and obviously DME into their practice. So really providing them that additional resource and support.
I gotcha. And let's talk about billing and coding, because this is an area that I certainly have, felt like some docs seem to like get it. Other docs, have issues and trouble. I mean, is this something that is insurance focused? Is it cash focused? Is it both? As long as you know what you're doing. If I'm thinking about billing, maybe what are a couple pearls that you've seen in your experience that docs should be aware of regarding sort of the billing and coding, or maybe those common hurdles that you've seen time and time again, chiropractors getting into it and just not understanding? I'd love to dive into some of your experiences on some of those so docs can know how to get into it the right way that ultimately helps their patient the most, but also is good from a business sense.
Cash practice is much different than billing and insurance, whether that insurance is, your car insurance, your patient's car insurance, whether that is your commercial insurance, whether that is Medicare, all of those things are obviously different. I mean, it could be work comp insurance, right? These are all different types that require different levels of, work and different potential, layers to there. So cash is what it is. And I'm sure if you have cash patients, you know how to work with those. But when it comes down to billing the proper codes, most often we're going to be talking about commercial-based insurance plans that people often get caught up in. So, and the two biggest reasons why chiropractors can often get caught up in that billing cycle is either they are using maybe the wrong CPT code for what they're billing, or they might not be using a definitive enough ICD-10 or diagnosis codes for what is required of that prescription that they're using. So it might not be warranted enough based on that diagnosis code they're using. So, we use the example of orthotics, right? It's a very common durable piece of durable medical equipment that you can find in a ton of different chiropractors' offices. And so if we use the example of orthotics, and maybe your patient is suffering from plantar fasciitis and the chiropractor wants to give the patient an orthotic to help correct that plantar fasciitis, they might use the correct CPT code for that, but maybe they didn't put the modifier of left or right on that HCFA form, right? And so now they're getting denied and they're wondering what's going on, and the insurance company might not even tell them what's wrong. So that's those little things of making sure that we're following just the specificity of what needs to be on the CPT codes is the first one. And the second one would be the documentation again and the specificity related to the actual diagnosis. So let's use the example of the plantar fasciitis patient that a chiropractor wants to give an orthotic for. Well, if the chiropractor just diagnoses the patient with extremity pain, for example, it's a little bit vague. It's more general. It's not specific enough that if they're trying to bill for a orthotic, it might not correlate with that CPT code, and this might get denied. So, they might want to get a little bit more specific with their diagnosis code and label it with potentially either plantar fasciitis or, specific pain in a specific region of the foot. So those are probably the main reasons that we see chiropractors often getting denied and kind of walking through that DME jungle that can related to billing and coding that can happen sometimes.
Gotcha. Two parts to it: the coding of the diagnosis code, as well as having those correct codes for the specific piece of DME. I get it. That makes a lot of sense. You mentioned custom orthotics. I'd love to talk a little product with you in terms of what are you seeing that are some of the products that either you or docs are most excited about. What are some new things that you're seeing? It might even be a few classics that are just tried and true, but what are some products that with DocShop Pro you see as the most popular, the most trendy? What are you seeing in the field?
Orthotics obviously will never get old, and we know that trends and little bubbles can come and go, but patients love obviously the tried and true methods of getting better and what's effective in your practice. So we always want to make sure that we're providing that first and foremost. And the new up and coming things, obviously, orthotics, there's different kinds of brands and different tools that can use, whether that's just insertables basic or that's really custom fitted type of orthotics. So there's lots of different benefits from there and options. But we also see nowadays a lot of more interdisciplinary integrated practices, if you will, right? So We're going to see more practices that have, more medical doctors and other nurse practitioners and board on staff, where now we're seeing a combination of different treatments. So maybe the chiropractor's performing adjustments and manual therapy and maybe rehabilitation, even maybe dry needling on a patient, and helping out on the conservative side where the patient might also be at the same time receiving maybe it's guided knee injections or some other sort of maybe regenerative process. That those two areas of the practice, the conservative and the invasive, really start to meet and blend really, really nicely. And so with that, we can help both the chiropractor and then the other part of the practice with different types of products and other DME and products that they use on a regular basis within their practice. We know that there's so many different products coming out every year, advances in one thing or enhancements in another, or even potentially a brand new type of treatment modality. And so that's where we can really provide that resource and education to chiropractors so that they understand not only the data, but also how to market it to their patient. We can provide them those resources so they're well equipped to support their patient base. Another type of practice that's really up and coming is a functional medicine type of practice.
Okay.
A little bit different than your traditional interdisciplinary or your integrated practice. This usually involves maybe a chiropractor and a nutritionist or health coach that is helping to manage that patient base. And these functional medicine practices are oftentimes focused on helping patients to address the root causes of their maybe chronic health conditions. So this practice usually uses more laboratory testing, and then on the DME side, maybe a lot of supplements and other dietary approaches. So with that, providing docs the level of supplement knowledge and protocols that they need to fit their practice is where we can fit those shoes as well.
That's interesting. When I think of DME, I automatically think of bracing, et cetera, but it sounds like at DocShop Pro, it sounds like you guys have a pretty wide berth in terms of what you're able to offer docs. You mentioned supplements as one of them. I'd love to talk a little bit about product selection, but a question comes to mind as well. You can choose on how you want to answer these in which order, but the educational component, you brought that up, and I know, you've written a few blogs for our Smart Chiropractor blog, and people were totally jamming on them. We have a few more in the queue. I'm excited to get out there. It sounds like education and provider education is also a big part of what you guys do over there. What does that mean to you? How does a provider education fit in? And maybe even a little bit on the product spectrum and how you think about getting all this together to help a doc, boots on the ground in their practice, because it certainly sounds like it's not easy for you guys.
No, absolutely. I think it comes with the territory, Jeff. We want to just provide the best experience for the chiropractor. We know what it's like coming into practice as a brand new chiropractor, as well as just if you're even a seasoned chiropractor. There's so much knowledge that is required of us to not only practice, but maintain that practice and then provide the best experience for our patients. So we really want to not just be, a place where you can order your products and say, here you go, because there's many different places out there. We really want to provide that back end support so that you as the chiropractor are really armed with that knowledge that how to not just use the product to the best of its ability, but also obviously support your patients in that respect from, allowing them to become aware of the product as well as become more familiar from a marketing perspective. So yes, education is huge. We obviously, there's so much to learn. So we want to make sure that we're also offering that latest and greatest data and research for the chiropractors. So because we know that it's ever changing on a daily basis. I think there's some literature study that shows the standard office, does not still uses research from maybe 7 years ago. So we don't want to provide 7 years old of research for our patients, chiropractors. We want to make sure that we're keeping up to date with all of it. So that's where we try to
I love it. And when you think about product, one of the things I know you guys work with, the seasoned docs, you work with the newer docs. Let's say I'm somebody who's never utilized DME in my practice at all, or maybe I haven't in a while. I kind of gave it a go, and for whatever reason, it just fell out of my traditional day-to-day practice. For somebody who reaches out to you guys, you're starting that conversation, you're understanding about who they are. What are maybe the one or two products? I know it depends on the doc, but maybe what are those one or two products? I always think about it like referrals. Before you get 100 referrals, you have to get one. And I think before you have a product line of 100 things in your practice, it's probably wise to start with a couple. What are those high impact, easy to implement type of products that you see docs really being successful when they get started with DME?
100%, Jeff. It's so important to make sure that you have a plethora of options to provide patients, because patients are going to come in, they're going to be asking questions. They're going to be telling you that they saw something at their local store, or that their primary care doctor told them something about a particular product. So it's a great question. We obviously want to make sure that we're providing them very simple to use DME. So if you're a chiropractor that's just starting off or coming back into that world and want to provide some of these tools, modalities, products to your patients, there's three big ones that are so easy to implement that are some of my favorites at all. And those are, the first one is just your standard orthotic. So again, most patients need orthotics, right? Yeah. You can still adjust the hips, the knees, the ankles, But at the end of the day, many patients still are going to have an imbalance, and so a lot of them can benefit from that. So that's the first one, and many are already wearing orthotics. So you can come in and provide them with an even more custom-fitted orthotic, because many patients will go to their store and they might buy Dr. Scholl's or something like that is not even close to being custom fit for them, and it might be even harming them more than it, if they weren't to use an orthotic at all. So that would be the first one, just very simple to use. The second would be common modality units, which is such as TENS and ultrasound units. These are so commonly used. Patients buy them all the time, but most patients don't know how to use them properly, one, and also they might not even be getting the therapeutic level of benefit that if you were to show them how to use this properly, that they could benefit. We know that you can get so many different benefits off TENS units, from pain management for the just gating pain, all the way up to actually stimulating muscle growth, right? We have a lot of really, really cool ways to using these different tools. So TENS and ultrasound units are probably my second pick there. And I would say that the top third product that is really easy to implement is a laser.
Okay.
We know that lasers have such an impact in the overall health and the healing process. But also they're just really, really easy to implement in your practice. And for all these products, patients can take these home. They can take them home. You can rent these products to patients. You can sell these products to patients. You can utilize them in your office. So there's so many different ways of using these products. And we know when we get the patient involved in their treatment plan and their treatment protocols, we have much better outcomes. We have much better compliance. So those are those will probably be the top three items that are just so easy to implement and are very, very helpful to patients as a whole.
That makes sense to me. If a doc has never worked with you guys at Doc Shop Pro before, or maybe probably about to after this interview, what's maybe the one or two things that you would point out that makes you guys different? What gets you excited, kind of showing up each and every day, interacting with the docs, and what can they expect as they begin to reach out?
Jeff, at Doc Shop Pro, we do a heck of a job trying to benefit chiropractors as a whole. We want to obviously advance the profession. It's not enough to just provide the product. We want to provide the education. We want to provide that consulting support. So if you have a question about a particular product, we can obviously find that product for you, find the best one for you of what you're looking for, whether that's a table, whether that's a modality piece of equipment, whether that's an X-ray unit, as well as then again, helping you understand the best way of using it. Even possibly if you already have a product that you're using, we can always cost compare to what we have and maybe get you a better price on what you have, or upgrade your current model. So we really want to just provide that back end support, and that's what makes me excited, is helping chiropractors grow their practices, not just from getting products, but using products in various ways in their practice, and then helping them market those to their patients so that they're getting their best ROI of purchasing that product in the first place, and really just benefiting a ton of patients in the process.
I think that's awesome. You open up the floodgates to price comparison. So the follow-up question is, where can docs go to learn more, to engage with you guys? We'll be sure to drop the links down in the show notes, but I'll have you just call it out. Where's the easiest and best place for docs to make that connection, start the journey, see more about what you guys are up to, and really kind of take their practice to the next level in a new way?
Definitely. Thank you, Jeff. You can find us at DocShopPro.com. So that's DocShopPro.com. We have an entire team of staff that will help with any sort of questions you might ask from specific products. I am there to provide support as well. So if you need to jump on a call with me specifically, more than happy to help and provide you as much support as you need. So,
Anthony, this has been awesome. It's been insightful. I think we'll probably do a part 2 and dive in. I wanted to kind of set the stage, especially for those docs out there that are new to this conversation. I appreciate you really pitching in. I appreciate the education you've provided our audience to date. We'll be sure to drop those links down below. And I want to encourage everybody listening, if you haven't checked out DME lately, please do so. Or as you said, if they're using it, if you as listening are using it right now, see if they can get you a better price. It's a great opportunity to make a connection. You might make a new relationship that really benefits your patients and your practice long term. So Anthony, thanks for coming on. I really appreciate it.
Jeff, thank you so much for having me. It was a pleasure.
Hey, what's going on? If you loved that video, be sure to subscribe to this channel. The Evidence-Based Chiropractor puts out videos all the time at the intersection of marketing and research, showing you how to grow your practice while also growing your knowledge base. So if you liked it, be sure to comment down below or hit subscribe, and I'll see you in the next video.